State health officials say health care premiums for some Minnesotans are set to increase by more than 21% next year. That would be for people on MNsure, the marketplace established by the Affordable Care Act. Right now, it covers tens of thousands of Minnesotans. But that's not the only cost that could be a prescription for trouble. As Caroline Cummings reports, hospitals warn of big losses due to federal funding changes.
Based on these numbers, these seem terrifying to me.
Minnesota hospitals told a Minnesota Senate panel assessing federal impacts on the state that changes to Medicaid and the so-called One Big Beautiful Bill Act could put some of them on life support.
Last year, 40% of our hospitals had negative operating margins, so we are not in a very good financial position right now to absorb any additional losses.
Those losses could total more than $620 million a year based on the state estimate that 140,000 Minnesotans will lose Medicaid coverage when the new law kicks in 2027. The Minnesota Hospital Association says that could have some dire consequences for care.
We will be forced to close additional services if these cuts come to full fruition, and we're going to need your help. We can't maintain the level of services we have 24/7 unless something changes.
And the impact could be even greater if Congress doesn't act to extend subsidies designed to bring down the cost of health care premiums. A COVID-era Affordable Care Act tax credit is set to expire at the end of this year, and that's an issue at the center of the federal government shutdown fight.
Hospitals say without those credits, thousands could drop coverage, driving up uncompensated care at hospitals to the tune of another $100 million.
The individual market is focused on individuals, farmers, small businesses, whereas in the metro we have larger businesses, more group coverage. So for that reason, we think this hits harder in rural areas.
At the Capitol, Caroline Cummings, WCCO News.
MNsure estimates up to 45% of enrollees could drop coverage with all of the federal changes taken together.